I am Rona Joy Bataller from BSMT-2B, and
I am Ariel Areja
and now we are going to discuss
unintended pregnancies.
In this discussion, we will discuss about what is unintended pregnancy, the global rate of unintended pregnancy, how common is unintended pregnancy, factors associated with unintended pregnancy, impacts of it, how to avoid it, and the significance of the topic for the people and the community. So first, we will discuss what is unintended pregnancy. Unintended pregnancy are pregnancies that are mistimed, unplanned, or unwanted at the time of conception, such as no children or no more children were desired, and other is mistimed, such as occurred earlier than they desired. The global rate of unintended pregnancy. Worldwide, about 85 million annual pregnancies are unintended, or greater than 40% of all pregnancies. These pregnancies result in 50% abortion, 12% miscarriage, and 38% unplanned birth.
How common is unintended pregnancy in the Philippines? 36% of births in the Philippines is either unwanted or mistimed. This is according to the National Demographic and Health Survey. Unplanned pregnancies are more likely to occur among older women than younger women. The survey data reveals that more than half of the births in the Philippines ages 40 to 44 were unplanned, while the majority, which is 84% of such births, were unwanted. Among women ages 15 to 19, 31% of births were unplanned, of which only 21% were unwanted. Significant rise in maternal deaths and unintended pregnancies feared because of COVID-19. According to the study of the University of the Philippines Population Institute and United Nations Population Fund, it is said that this pandemic has disrupted family planning and maternal and newborn health services globally. And the Philippines, to these indirect effects, may significantly increase the annual maternal deaths and unintended pregnancies for post-COVID years compared to pre-COVID years. The Philippines unfortunately showed one of the highest rates of adolescent fertility in Asia prior to COVID-19, and it is described as a national social emergency.
Factors associated with unintended pregnancy. Adolescents. Younger women who are active sexually are less likely to use contraception than other age group, and thus are likely to have unintended pregnancy. Approximately 18% of young women aged 15 to 19 years old at risk of unintended pregnancy do not use contraception, compared with 30% of women aged 20 to 24 and 10% women aged 25 to 44 years old. Next is low socioeconomic status. Poverty and lower income increases a woman's risk of unintended pregnancy. Unintended pregnancy rate among women with income less than 100% of the poverty line was 112 per 1,000 in 2011, more than 5 times higher than the rate among women with income less than or greater than 200% of poverty, 20 per 1,000 women. Lack of or improper use of family planning methods. Methods of contraception plays a vital role in preventing unintended pregnancies. Study shows that 85% of women who stopped using contraception became pregnant during the first year. Lack of sexual education or awareness. Awareness about sexual and reproductive health or SRH matters, especially or specifically about methods of contraception as an important step towards gaining access to and using a suitable contraceptive method in a timely and effective manner. Non-consensual intercourse, sexual coercion, rape, or even forced pregnancies may be associated with unintended pregnancies, all of which sometimes happen in a context of domestic violence. Unintended pregnancies are more likely to be associated with abuse than intended pregnancy. The rape-related pregnancy is 5% for rape among victims of reproductive age 12 to 45 years old. Among adult women, an estimated 32,101 pregnancy results from rape each year.
Pregnancy. Pregnancy intent is an important determinant of both short and long-term maternal and child health outcomes. Pregnancy intention may affect attitudes and behaviors in parenting and eventually have an impact on child development. Pregnancy intention also has long-term influences on child health. Some studies show that children born after unintended pregnancies showed a cognitive delay at 3 years old, more behavioral problems at 5 and 7 years old, and increased problem behaviors and substance use at 14 years old than those of their counterparts. Unwanted births may also cause poor relation between mother and offspring, even after the child have become an adult. Unintended pregnancy is a risk factor for poor maternal mental health, including perinatal depression, parenting stress, and lower levels of psychological well-being and life satisfaction. The Philippine government has made efforts to improve access to contraceptive services, but still abortion is illegal under all circumstances and is thus highly stigmatized. Nonetheless, abortion is still common but is often performed in unsanitary conditions and using outdated techniques. Unsafe abortion carries significant risks for Filipino women. About 1,000 women die each year from abortion complications, which contributes to the nation's high maternal mortality ratio. Tens of thousands of women are hospitalized each year for complications of unsafe abortions. How to avoid unintended pregnancy? Many women in the Philippines are unable to achieve their desired family size and have more children than they want. Unintended pregnancy is common in part because of the high unmet need for contraception. Policymakers and government agencies should educate the public about contraception, ensure adequate funding for contraceptive services, and eliminate barriers to obtaining methods, particularly among disadvantaged populations. To help destigmatize post-abortion care, the government should train more providers in the use of safer and less invasive methods of care. Next is male and female condoms. Both are available without the need of prescription. These are more than 80% effective against pregnancy, according to the Centers for Disease Control and Prevention. Contraceptive pills. Birth control pills are one of the most commonly used methods of contraception, but with typical use, they are approximately 95% effective. This is also according to CDC. Natural family planning. The natural method of contraception involves tracking the menstrual cycle and avoiding sexual intercourse when the person is in fertile phase of the menstrual cycle. According to the Centers for Disease Control and Prevention, natural family planning methods are about 75% effective when followed accurately. Sterilization. Both women and men can undergo procedures that can permanently reduce their fertility. Men can get a vasectomy, in which it involves snipping the tubes that carry the sperms, while the women can have a sterilization procedure known as the tubal ligation. Significance of the topic for the people and community. Unintended pregnancy is one of the most critical challenges facing the public health system that imposes substantial financial and social costs on society. Early and unintended pregnancy is one of the issues that is worthy of attention, as it can jeopardize the educational attainment of a person, and for this reason, the education sector has an obligation to prevent it by providing knowledge, information, and skills. It is potentially a critical lever in the girls' empowerment that increases knowledge and self-confidence and improves girls' awareness of themselves, their bodies, their rights, and capabilities, including preventing pregnancy and fertility choices. Boys and young men typically bear less of the consequences of pregnancy, but still they too need to be engaged in this response. That is the end of our topic, and thank you for listening to this video.
Thank you for listening.